Hello, everybody. Welcome to AV's Maxillofacial and Dental Talk to one another episode. And this time we have something interesting, something new. And today I have with me Dr. Janani Murali, senior from my college. Ma'am, can you please give a short intro about yourself?
Yeah, I'm Dr.Janani Murali, and I have completed BDS from Sri Ramachandra University, and I am a certified medical coder from American Academy of Professional Coders, CPC certified professional coder, and also like from AHIMA, that is American Health Information Management Service. Over there, I have completed CCS. That is also a medical coding specialty. And then like I am a multi-speciality medical coder as well as a dental coder also. Apart from that, I had completed a fellowship in forensic odontology as well as fellowship in facial cosmetology and aesthetics.
Wow, that's quite a big and interesting profile.
Yeah.
And I've definitely heard about medical coding, and but I really do not know what it is all about. So can you please tell what medical coding is all about and how a BDS graduate, someone who has just finished his or her BDS, will be able to approach or apply for the same?
Yeah, medical coding generally, it's what we generally do it in our day-to-day life, like taking the patient's case sheet. We all work with the case sheets only in the medical coding. So where we will be converting a patient's medical record, whatever record, it may be an operative record or a discharge summary, into a universally accepted alphanumeric codes. It will be like alphabet and numeric codes will be there.
Okay.
So a specific sets of codes will be there. Like, like we do SOAP charts, like subjective, objective, assessment, and planning. Like in general medicine, even in oral medicine, we will be having once a patient walks in, first of all, we will be taking the case sheet. So in that, like the assessment part, that is the disease part, we will be providing with a code that is like the diagnosis codes. We call them as ICD 10CM, which is International given by World Health Organization, and CPT, which is current procedural terminologies, that is the procedure codes, what the doctor does. That is your planning, generally the treatment plan, or the operative report means what the treatment had been done by the doctor. And the HCPCS codes will be like the supply codes, like if they are doing it laparoscopically or whatever materials, whatever supplies they are using. If the patient had come with a fracture, they would be putting on a fiberglass cast. So for that material, there will be a code. So the major purpose of medical coding is like we mainly work for US healthcare. Okay. So over there, we will be providing with for the reimbursement purpose for the doctors. Okay. General, it is like a trio. Okay, like there will be a doctor or a provider. We generally call them as a provider, and then will be a payer. Payer is the insurance company. In US, like all the citizens will be having an insurance. So either it might be a federal like Medicare, Medicaid, or a private like how we are having it over here. Aetna, like that, like we have lots of private insurance also. So over here, the insurance people feel it very difficult to find the terminologies what we use. Like if we say like in a dentist term itself, if I say like acute gingivitis, they doesn't know what is acute gingivitis. So instead, we are giving a D code, a dental code means, then they will be, okay, for this code in this location, this amount we have to pay to that doctor. So that we make the, if only we code the codes correctly, the doctor will be getting payment from the insurance company. So it highly depends on us, like the coders. And dental coding is also similar to medical coding. It depends like as per the specialties like oral medicine, implantology, and then like endo, pedo, like whatever departments we are working on. As per that, we have a specific set of dental codes also given by American Dental Association. Yeah, in coding, actually, like this is all the types of coding what we are doing. And as per the regions, the coding again, we have it like American, Australian, or Canadian coding. So the base will be always the American coding, which is very cost effective when compared to the other two. And we don't need IELTS to clear this American coding exam. We can do it from India itself. So when a person is going, like my students will be like, our place is mainly for dentists. So our students who are moving out abroad, they go with a career. Like generally, like a dentist or a medical person who is going out, they have to go there, give the exam, then only they will be doing it on. But if they
Okay.
are a coder, if they are a CPC certified person, they go with the career itself, like with the coding itself, like they can go and work over there.
Okay. Okay. That's really interesting, ma'am. Now, as you been mentioning about coding and the transcripts, one question which pops in my mind is, yes, as dentists, we'll definitely have an advantage as to about the medical terminologies and we helping out the insurance companies. But what computer knowledge do you require? Because in some schools, most of us are trained with MS Office, and some of them may know C plus or C plus plus. Yeah, I mean, I'm not trained in C plus or C plus plus. So, is there something specifically you need to know even before joining a medical coding course? And
Nothing,
follow up
we
question
need.
and follow. Yeah, yeah, please, 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 please. I just want to add a
Yeah,
follow up question. Follow up question is like, so currently medical coding is applicable only for the abroad countries, and whether you can work from home, meaning whether we can work in your from your country also, and not made much of progress in India, right? These are my questions.
so yeah. So regarding computer knowledge, basics, what we know, that's more than enough. Like if you know Excel and the PowerPoint, like if you are going as a TL, like if you know the typing skill, that is more than enough. Because like 95% of the job is like AI and it is done by the software itself. As we know,
Okay.
being dentists, like the 3M products which we get, the same person has created the software also. The medical coding is ruled by the 3M people. So from that only the practices, like whatever the clinics they are having, they will modify the software as per their requirement. So typing also, it's not like very fast, and just you have to take up a code. Nothing more than that we are going to take. From the patient's case sheet will be provided to us. So analyzing the case sheet, we have to take what is the disease. Like in history, if the patient is having like history of hypertension, okay, history of hypertension, we have to provide this code. This is the diagnosis code. And what the patient is suffering currently, like any fracture of knee or fracture of mandible. So that code we are going to put it in. Only like 2 to 3 codes we are going to put in if it is a diagnosis code. And procedure, like what we will be doing, like open reduction, all those things. If it's a fracture, we generally do the open reduction. So for that code only we are going to put on. Type, what you are going to type is just the codes. Nothing more than that we are going to need. Like if you are
Okay.
going to upgrade in your career, and as you asked, like in India, actually like
Hmm.
India, it is a software field. Totally, it's a healthcare software companies we are going to work it on. Like from US, they are outsourcing it to India, and from India itself, we can work on. So almost in
Okay.
Chennai, around like 75 companies of healthcare is taking care for coders. And
Okay.
every month there will be like 100 openings. And the career
Okay.
growth will be also like a software engineer only. So like at present, like at starting, they will be going as a trainee, then a junior executive or a junior coder, then a senior coder, then they become a team leader, then they can go on for a manager, and they will be going on for the top management. So this will
Okay.
be their career ladder. And when
Okay.
they move on for a TL and being a dentist, what will be the beneficial means? Like if you are a certified coder and a doctor, either that means a dentist, 3 years to 4 years of experience is more than enough to you to become a TL, where you will be
Okay.
earning around like 1 lakh in India.
Okay.
I'm talking about in India. If it is
Okay.
in abroad, it is totally a different scenario. In UAE,
Okay.
you will be getting minimum of 5 lakhs
Okay.
per month. And then in UAE, depending on the specialty you're going to work on, minimum of, in US, I'm sorry, in minimum of they per hour they will be getting around like $20 to $50. It depends on the
Okay.
specialty again.
Okay. Okay. Okay.
So it is a really good and work from home opportunities. If you are a certified coder in abroad, we have work from home opportunities a lot. In
Okay.
India, they had revised it from 2023. Like some companies are recruiting work from home, and some companies they had called back them. Like like in news also we have seen like all the TCS and all the companies have called back their employees for the office itself. So it depends on the company and the project which we are working on. Either like we can go for a work from home, or you can go for an work from office itself.
Okay. Okay. Ma'am, that is it's like quite interesting, and how about like, are there people who are practicing and simultaneously also doing this, or is it going to take your time exhaustively where you can consider this as a full-time career?
No, sir, it's not an alternate field. For a dentist, it will be a parallel field only. So for
Okay,
generally, like we practice in the evenings, like after 6.
okay,
6 to
okay,
11, 1 day will be the peak hours of the practice. Morning hours, we are going to use it for the coding. So 9
okay,
to 5
okay,
or whatever time. And if you're working from home, means it is almost like working from clinic only. So if you get a
okay,
working from home opportunity, you're going to work from there. They will be giving you like certain amount of claim. That means a certain amount of sheets you have to, like per day 90 claims you are going to complete, means like that you can complete majorly in 4 hours. Not
okay,
more than
okay,
that. It's going to time consuming for us. For being a dentist and being from a medical background, we'll be easily analyzing it. And this part is where we will be using our knowledge in from the what we studied in the third years, like general medicine, general surgery, all those things will be coming into implications over here.
okay, okay, okay. That is quite interesting, ma'am. And now one other issue, or not issue actually, a doubt is that so the first thing which people ask me is like, what is the eligibility criteria to apply for this fellowship or to become a medical coder in the first place? And like, should you have completed BDS or should you have completed final year, or whether you can do it during your internship also? That is my first question. And also, can you briefly tell us about your institute and how you handle the courses and how people can approach you for the same?
So for this, the basic criteria to study is like an internship itself, like they can start joining. Like once they are like from this, I have a students like from third year, final year and internship. All 3 years, they are, once you're going to work, like once you're going for a job, you should be having your provisional certificate minimum. Like if you're going
Okay,
to work in a company, course completion and a provisional should be mandatory over there.
okay,
So to go and work in the company. So maximum my students, they will be like all are like 95% they are dentist only, and the trainers over here in our institute is like all are doctors who are certified coders. Like they are
okay,
dentists, they had completed CPC and they had settled in US or Mauritius and UAE, India. Like depends as per their time zones. We have the separate set of doctors, like trainers for their like if the student is from US, like the US trainer will be taking care of them. So there won't be any issues for them to like, okay, the batch starts over in India at 5 o'clock, means for them it will be in the morning session. So for them,
okay,
like whatever timing they are comfortable, as per their time zone, we are conducting the classes. And
okay,
it's same applicable for other countries also, whichever country the students are from. And it's mainly we have offline as well as online classes, and 90% the students are online only, because all are basically settled in abroad, or like they are in colleges, they are doing internship. So like after college evening sessions they will be free, like at that time they want to come. So like for that reason, like we have it in virtual classes, and it's not recorded, and it will be a live classes. Every day the trainer will be coming and taking up the classes till the like. And then this is a fellowship course, it is a fellowship in medical and dental coding. It's not like other institute like where they give very basic coding. So here we have the case sheets. We will be working on the live case sheets, and we will be working on the, it will be in 7 modules, continuous modules itself.
okay,
So after completing the course, we will be providing them with the placements in the companies. So after like some companies, they provide the, you see, like this fellowship itself, it will be covering with the CPC exam preparation, that US exam preparation, the
okay,
fellowship. So after completing the fellowship, we place them directly in the company before going on for the CPC exam. Because as per today, the exam fees is $500. At most, like
okay,
it will be coming around 60 to 65,000. So some
okay,
companies, they will be providing the students, they will be sponsoring the students over there. So if
mm,
their performance are good, like 6 months to 1 year, if they need a certified coders, means they will sponsor. So once these people are trained and entering in, means like once they are trained, so only thing is like they have to give the exam. The company will sponsor it, don't go out from their pocket.
okay, okay,
So they can save it from that end also. Or else like
oh,
financially, that is not an issue, ma'am. Like after completing 3 months of, this is a 3 months course actually. So
okay,
this 7 module is a 3 months course, 150 hours, it will be roughly coming around. So once you complete it itself, like you can go and give the exam. So you will be completely trained. Like once you're going out, like you will be trained not only in medical coding, but also in dental coding also. Dental coding in India, we are the only people providing it over here. So being dentist, I
Okay.
want the dentist to know about the dental coding also. So we provide dental coding training also for them. So mandatorily in UAE, they ask for a dental coder. Like that, like in polyclinics and all, when they are coding, so there will be one part will be a dental wing. So for that alone, they can't keep a separate coder. So once if you are recruiting means they will be recruiting, if you know a dental coding, it will be an added advantage for you also. And financially also it will be supportive for them.
Okay. Thank you so much, ma'am. Is it okay if I can share the details of your contact so that the people who are interested can approach you? And is there something else you want to add, something which I have missed asking, because some other doubts which people might have regarding this fellowship in medical and dental coding?
Yeah, like the age limit. So in abroad means they don't have any age limit to give the exams. Okay, so over in India also they don't have any age limit to give the exam. But if you go joining in as a fresher in a IT company in India alone, they have an age limit till 32 years. If you're a
Very
fresher,
good.
and
Okay.
some places they even recruited. That's not an issue. It depends on the company, but it will be like very less opportunities will be there. Before 32 years, it is very good opportunities they are having it on. And then I wanted to tell all the dentists mainly who are settled in abroad, like many of them haven't stopped their practice itself. Like many girls, to be very honest, like after marriage they go settle over there, and like they can make use of medical coding to start as a new career for them. And in US they call them as remote coders. You can work from home itself in the company, in the clinics, or job opportunities are lot in abroad. As well as in India, they are just starting it off. We have already started disease coding. We are not following procedure codings. But abroad, like almost like 180, 120 countries, we are following US healthcare. So it will be very easy for them to get placed wherever they are, regardless of the place. So if in any hospital in the billing wing, they will be getting paid.
Okay. Thank you so much, ma'am. Thank you so much for your time. I'm sure it will be very useful, and a lot of people are going to consider this also as a career option. Thank you so much for your valuable time.
Thank you, sir. Thank you so much.